There, everybody. Here is a pretty short video designed to just go over a couple of topics that we might not have covered in class. And I just wanted to make sure that you are ready and comfortable going into our first unit test. So, oogenesis is a lot like spermatogenesis in that it's the process by which gametes are formed, but of course, specifically, we're talking about the egg, and so we're in the female reproductive system. And a big difference between male and female reproductive systems and gamete production is that in male reproductive system, each round of spermatogenesis is going to result in 4 sperm cells, but oogenesis only results in 1 viable oocyte or egg cell because eggs have to be so much larger, and in order to accomplish that, we're going to have uneven cell divisions, and so those smaller cells are not going to survive to become viable eggs. So that's like kind of just the big difference between the two. Okay, so females produce primary oocytes from stem cells that are called oogonia in the ovary, and that's actually going to happen during fetal development. And that's going to be through mitosis. So again, very similar to that whole mitosis before meiosis business that we talked about in the male reproductive system. The big difference is that in males, that's going to start at puberty, but in females, those primary gamete cells are going to form during fetal development. So females will be born with all of the eggs that they're going to have in their lifetime, and then those eggs just have to finish their maturation. Okay, so later on in that fetal development, those primary oocytes will in fact undergo meiosis, to 8 and 9 months kind of thing. But that meiosis is going to freeze in meiosis 1. Remember, there's 2 rounds of cell divisions in meiosis 1 and meiosis 2. So this is going to freeze very early on in meiosis 1, and that is where all of the eggs will remain in that kind of suspended state until puberty. And then at puberty, they will start the menstrual cycle, and every cycle a few eggs will begin the maturation process with the goal of having 1 viable egg each cycle. That will start with follicle stimulating hormone. Remember, that's going to come from the anterior lobe of the pituitary, and that will trigger the start of the ovarian cycle. So remember from class that there are things that are happening in the uterus, and then there are things that are happening in the ovaries, and hormones are kind of governing all of those things, and we want to have an understanding of the relationship of what's happening. So FSH will trigger that beginning of that ovarian cycle, and as a result, some primary oocytes each cycle or each month roughly will complete meiosis 1. And then the follicle will grow and enlarge, and the first one to mature will actually result in the egg being released from the follicle. That's called ovulation, and at that point it will sort of get swept up into the oviduct by the fimbriae, and the egg cell or oocyte will enter meiosis 2, but again it's going to pause when it reaches metaphase, and it won't finish meiosis 2 unless it's fertilized by a sperm cell. And if fertilization takes place, that will induce the completion of meiosis 2, and consequently we will have a zygote. That is to say, an egg that has been fertilized by a sperm, and we now will have 23 pairs of chromosomes for a total of 46 chromosomes, the normal diploid number for humans. All right, so let's look at some pictures here. Here's our ovary. Here are some little primordial follicles, so very early on, and then those primordial follicles will ultimately become primary ovarian follicles during fetal development. And so here in this picture, we can see here is the primary oocyte in the middle. It's surrounded by these granulosa cells and then other endocrine cells outside. That primary follicle will grow into a secondary follicle. So this is happening during the ovarian cycle as a result of hormone influence. And so this follicle is getting bigger. So you can see the nucleus of the oocyte. Here's the entire oocyte. And you can see some of the layers around it, including the zona pellucida, which is just important for, like, it creates a really good kind of protective encasing around the oocyte. And then if that follicle gets big enough, it will form a tertiary ovarian follicle. So you can see we're really getting some fluid in here. It's really grown quite a lot compared to our itty bitty little primordial over here. And so if it actually reaches full growth, that's called a Grothian follicle, and that will result in this secondary oocyte, is what we call it now, will be ovulated or released. And you can see a little picture here, an actual microscope picture here. So our egg is ovulated, and then it will get swept up into the oviduct. And meanwhile, the remaining follicle will become what's called the corpus luteum. And that's important because it's going to release progesterone, which we learned plays an important role in the secretory phase of the uterine or menstrual cycle. And then ultimately, the corpus luteum will form the corpus albicans, which really is just a scar tissue on the ovary. And at this point, it's not doing a whole lot. So that's the ovarian cycle. And you can also see it happening here in this beautiful chart. So we can see our little tiny follicles developing into a tertiary follicle, then the egg being released at ovulation in response to peaks in LH and FSH and also estrogen. And then we can see the continued formation of the corpus luteum. Notice that we have high progesterone, but once corpus albicans forms, progesterone falls off because this corpus luteum does produce progesterone, but the corpus albicans will not. If the egg gets fertilized and implanted, then the corpus luteum will remain throughout pregnancy, releasing progesterone. But if the egg doesn't get fertilized and therefore doesn't implant, then the corpus luteum will form the corpus albicans. It will stop producing progesterone, and that fall in progesterone is going to result in the shedding of the uterine lining. So there's a connection between what's happening on the ovaries and what's happening in the uterus. So kind of looking at it from a feedback loop, this is a pretty messy diagram, but follow the numbers, right? We've got 1, 2, 3, so that gives you a good idea of how to start. So here the first thing is we have gonadotropin releasing hormone, which I'm never going to ask you to know the name of that. But the release of that hormone, notice what it does. It goes from the hypothalamus to the anterior pituitary gland, and it will induce the secretion of FSH and LH. And we know that FSH and LH have direct impact. So FSH is going to stimulate ovarian follicle development, and it's also going to stimulate the secretion of estrogens. We're going to see LH is also going to stimulate meiosis 1 completion, and ultimately it will stimulate ovulation. And then if we end up with a corpus luteum, will then stimulate progesterone. So just following those through is pretty good. Take note that there is the production of inhibin, and remember inhibin is going to block the secretion of LH and also the secretion of FSH. And that's just important because we don't want them being released continuously every single day, right? We want these hormones to, come on and off in order to stimulate these important events. And of course, As a result of FSH, we can see we're going to have the follicular phase of the ovarian cycle, and then LH will be the luteal phase of the ovarian cycle. So this is the earlier phase, and then this is the later phase of what's happening in the ovaries. And of course, you can see all of the things that are going to happen down here as a result of these events that are triggered by FSH and LH. So there's not really anything new on this slide. This is really just what's in here and in here. They're just showing it in a different way and just showing the relationship of the hormones. We talked in class already about some of the different types of birth control. These are also all in your textbook. And I think probably the most important thing to just remind everyone is that birth control is not the same thing as protection from sexually transmitted infections. Condoms are the only form of birth control that also can reduce the risk of STIs. Any of the others are only about preventing fertilization, not about preventing infection from STIs. And then the last little bit is thinking about some of the clinical correlations. So we talked in the male reproductive system about prostate cancer and testicular cancer. So these are the two types of cancers that are most connected to the male reproductive system. Both of them are relatively treatable and have a great prognosis, particularly if they're caught early. Prostate cancer can be a little trickier if it's caught late or if it's a particularly aggressive form. So, regular doctor visits is always important to stay on top of these things. In the female reproductive system, we're looking at breast, ovarian, and cervical cancer. Cervical cancer is actually caused, most cases of cervical cancer are caused by HPV, and there is now a vaccine for HPV, and that getting vaccinated for HPV dramatically reduces your risks of developing cervical cancer. Ovarian cancer is a stinker because it's very asymptomatic until it's already oftentimes invasive, and so this is a much more difficult one to treat because detection is often later. And of course, breast cancer is quite common. Some people are at genetic risk for it. We can do mammograms to look for potential cancer tumors in the breast, and again, that's something that women typically are expected to get once every year, every 2 years, depending on your age. And those recommendations are specific and something that you can talk to your doctor about. And then also it's important to just remind ourselves that these are the reproductive systems, and so sexually transmitted infections or diseases are a thing, and they are not without significant risk because many STDs are not particularly symptomatic until they have already created significant scar tissue in, say, the oviducts or the spermatocord, and that can lead to sterility or infertility. So, you really want to protect yourself by making good choices. And also another thing that's kind of become more commonplace in the last decade or two is that more STDs like gonorrhea, for example, are becoming antibiotic resistant. So we don't have the drug or pharmaceutical tools on hand to knock out these infections as easily as we once did. And then some STIs, if they're viral, like herpes, for example, or genital warts, we don't have any cures for those. And so once you catch them, you get to keep them forever. We sometimes have medications that can reduce outbreaks and flare-ups, but you'll always have that and could pass it on to someone else. And so again, it's just important to make good decisions and try to avoid getting these kinds of things in the first place for your health. And that's it. So now you're ready to knock out some great studying for your first unit test.